Hi, good afternoon from the annual meeting in San Diego. We're pleased to be here with Joe Theine. Thanks, Joe, for being with us today.
Yeah, my pleasure. Thanks, Jonathan, for having me.
Joe, there's been such a great focus at this conference on practice management, and I know that you bring some particular expertise about a novel analytics for practice management and to help analyze the practice's financial health. Can you give us an overview of how that service works?
Yeah, one of the great tools available both to members of ASCRS and ASOA is called ASOAnalytics. Really the goal of that is to help physicians and their practice administrators look at the financial health of the practice, make sure that things are running well.
So, Joe, how does this work? How does the analytics team get involved in helping the practice to understand its financial health?
Yeah, so first, just as like physicians look at the health of a patient, a lot of times you're collecting subjective information from the patient, and then the staff or you are looking at some objective data like IOPs or other things. From an administrator side, a lot of times we're doing the same thing about the practice. ASOAnalytics is designed to help get some objective data. And so you start by putting in some of the financial information into the tool about the physician's productivity, expenses, things like that. And once that data is in the system, it's compared to the other data that's submitted. So benchmarks or national norms are really what a healthy range is for things like overhead costs, staffing costs, things like that.
Of course, we should also understand, though, that that overhead costs and some national norms may not be applicable to every market, right? So perhaps a big city practice versus a rural practice might have different expenses and different overhead. Is that something that the tool can look at as well?
Absolutely. Yeah. So benchmarks are often done in ratios. So, for example, if you're looking at a provider's productivity and you're looking at the whole practice, you would look at the number of patients seen by provider, not number of patients seen for the whole practice. Also, the database collects some basic demographic information about the practice as one of the first steps. And some of the questions ask how many providers are in the group, are you in a rural setting or are you in a metropolitan setting? And as you start looking at the data, you can look at some common things. So are we looking at 2 metro practices or 2 rural practices to help guide some of those analytics?
So I suppose then if the practice is able to compare their metrics in several of these parameters to national norms based on geography and location and so forth, they can sort of gauge where they may need to make some changes or improvements in their practice pattern.
Yeah, it's exactly right. So just like as a physician, when you're treating a patient, after you get through that subjective and objective assessment, you start to make an assessment and develop a plan. And so administrators do the same thing. Use that information that we're collecting, help assess what may be outside of a healthy range, and then work with the staff and the physicians to develop a plan to improve the financial health of the practice. It's exactly right.
Well, Joe, this has been such a fascinating look for us into this great analytic tool that's available to the membership. If members are interested in learning more about this, where can they go to find information? Yeah,
great question. So they can go to either the ASCRS or really directly to the American Society of Ophthalmic Administrator page and look for a link to go to ASOAnalytics, and there will be lots of information about how to sign up and register there.
Amazing. Well, Joe, this has been a great discussion. Thanks so much for sharing your expertise with us. We really appreciate having you here.
You bet. Thank you. Have a great day.
Great.